Hello, my name is George. I'm going to perform a thorax, lung, heart, and peripheral vascular video assessment. Christina is going to be my volunteer. Christina, do you give me consent to perform this assessment?
Yes.
Okay, thank you. So first I'm going to start with the thorax and lung assessment. First I'm going to inspect for any deformities on her thorax, upper chest area. So I'm looking here. There is there are no deformities. I note symmetry in her anatomy. So then I'm going to proceed with assessing her respiratory rate, if she's using any accessory muscle used to respirate. So in a normal assessment, I would count her respirations for a full minute. I see that she's breathing at a normal rate, so her respiratory rate is between 14 and 20, which is the normal range for a person. She's not using any accessory muscles to use, so that's a normal finding. Then I'm going to listen to her lungs. So I'm just going to have you turn that way. So here on the side. Take a deep breath. Good. So normal lung sounds, no wheezing, no rouse, no rhonchi, no adventitious sounds. Expiration and inspiration are equal. And you have no shortness of breath today, right? No shortness of breath. Then I'm going to assess for tactile firmitas. So I'm going to palpate for that. If you can say 99 for me.
99, 99, 99, 99, 99.
Okay, so here we're assessing for firmitas for lobar consolidation. Then I'm going to do the same motion here, just on the side. I'm assessing for a lung expansion and excursion. I want you to take a deep breath for me. Okay, so this is normal. I put my hands here on the base of her lungs, and I'm looking for a 3 to 5 centimeters distance between my two thumbs when she's inspirating. So then, after assessing her lungs and her thorax, I'm going to I'm going to perform the 3 special techniques: the bronchophony, egophony, and the pectoralicoe. So now I'm going to auscultate again for egophony. So I want you to say, repeat, when I auscultate, just say E, E, okay?
E, 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 E.
Okay, so the normal sound for me would be from an E that the patient is saying. I hear an A, so that was a normal finding. Then I'm going to proceed for bronchophony. Just to add a note for egophony, if we heard louder noises and more like the same sound as an E, that would be an indication for a respiratory disease like pneumonia. Then I'm going to auscultate for bronchophony, and I'm going to have you say again 99 when I auscultate.
99, 99, 99, 99.
Very good. Okay, so that was normal as well. And the last special technique for the lung assessment would be the pictoriloquy. So the patient will whisper 1, 2, 3 when I auscultate.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, perfect. Very good. So I completed the thorax and lung assessment, and I'm gonna move forward with the cardiac assessment. So you can turn towards me. So first I'm going to inspect her jugular venous pressure and her carotid pulse. So the patient should stay, sit in a supine position and in a 30 to 45 degree angle. So I'm gonna have you lean back a little bit. Then you can turn your head to the left. So I'm gonna have you placed here. Okay. So here for the jugular venous pressure, we inspect for any pulsations and for the carotid pulsations as well. So we're looking here at the sternocleistomastoid and up into the jaw. It's like a triangle here that we inspect. Well, I don't see any pulsations. Then I'm going to auscultate for bruit, which is like a whooshing sound. Very good. Then I'm going to, so I assessed her carotid pulse for any bruit. Then I'm going to palpate her chest for any thrills, heaves, fremitus, sorry, not fremitus, crepitus, in the anterior chest. So I'm going to have you sit upright again. So I'm assessing here. Can also percuss as well. Okay, very good. No abnormal findings. Then I'm going to auscultate her heart sounds. So I'm going to start with, I'm going to auscultate in 5 areas. I'm going to start with the aortic, pulmonic. I'm gonna do that as I speak. So right here, the second intercostal is the aortic heart sound. Then it's a pulmonic at the same space on the right side. Then we have at the third intercostal, we have the Erb's point. And lower, we're going to the tricuspid. And the last one would be at the 5th intercostal, would be the mitral. Very good. No murmurs noted. Normal heart sounds. Good rate. The last thing I'm going to do, I'm going to auscultate again for the S1 and S2 heart sounds at the apex. Very good. So we note the systole and diastole from S1 to S2 and then from S2 to S1. Okay, so 2 special techniques here. I'm going to have Christina sit in a left addecubitus position. So you're gonna go on your side here. You can lean. Yep. So I'm gonna assess for mitral stenosis at the left sternal border. Very good. And now the last special technique will be assessing for mitral regurgitation. So, I will have to have you stand up. So, I'm going to auscultate again in the same area, but I want you to lean forward and then take a deep breath. Let the air out and hold your breath after that. So expirate after that. Go ahead. Very good. Okay. So that was the last special technique for the cardiac assessment, and now we're moving to the last part of the of today's video assessment. So, first thing, you can sit down now. Sorry. First thing I will assess is for any. So I'm going to assess her lower extremities. So we see here both. So we check for edema, so any swelling in your extremities, hair distribution, venous abnormalities, any ulcers, any skin issues, so any edema that I said. I don't see any of that. No edema. Hair distribution is the same. There's no hair actually. No ulcers and no other issues that I see. I'm going to palpate for, I'm going to move up to her upper extremities. I'm going to palpate for her radial artery. Strong pulse, very good. Then I'm going to do palpate the brachial artery. Then I'm going to palpate her epitrochlear lymph nodes, which are here, kind of in the back of your elbows. No tenderness, no swelling. I'm going to move up. I'm going to the armpit area, so the axillary lymph nodes. No tenderness either. Very good. And then after assessing the upper extremities from a peripheral vascular standpoint, I'm going to inspect her, to palpate her abdominal aorta, which would be right here. Take a deep breath. Not too hard, obviously. Probably one of the most important arteries here. So that's good. No issues there, no pulsations, no pulsatile mass. Then I'm going to assess her superficial inguinal nodes, lymph nodes. We're assessing here for any swelling or tenderness. Nothing here. And the last set of palpations would be for her femoral artery, which would be right here in the thigh area. Her popliteal artery, which would be the posterior area behind the knee. The other side, sorry. Then I'm going to move back to move down to her posterior tibial, which would be on the lateral side of her ankles. And the dorsalis pedis, which is basically midway from the toes to her ankle, right here. Very good pulses present. That means good perfusion. Okay, so after assessing all these pulses, I'm going to perform one last special technique. That would be the Allen test. So the Allen test, I will have Christina do this motion rigorously for like 5 or 6 times, and then I'm going to block, basically press against her radial and ulnar arteries, and then assess how we will see in a normally perfused extremity, upper extremity, we will see the hand turning red, meaning good perfusion. So I'm going to have Christina do this. Okay, now I'm blocking the arteries, and letting go. And we'll see, we see that her fingers and the base of her palm become red. So that was the brief assessment of the systems that I mentioned. And thank you.